Well, he was responding to leading neurologist and author Dr Suzanne O'Sullivan and a book that she's written called The Age of Diagnosis, Sickness, Health and Why Medicine's Gone Too Far. She joins us now. She says that far too many people are being told that they're ill when either they're not ill or telling them won't actually help them because there's nothing that can be done.
Good morning.
Morning to you. This is a really interesting thesis. So basically, doctors are going too far in diagnosis.
Yeah, so I think this comes historically from a history of underdiagnosis. So in the past, people have gone to their doctors too late with medical problems, or we've had people struggling with mental health problems who didn't feel able to come forward. So we had a chronic diagnosis problem. We wanted to fix it. We had an assumption. If you find milder versions of medical disorders, if you find earlier versions of medical disorders, you can promote healthy populations. But I fear what's happened is that we have taken that too far. We are finding things at earlier and earlier stages when they don't necessarily need to be treated, and we're beginning to turn healthy people into patients.
So it affects their mindset. Somebody who actually is fundamentally fit and well and healthy is being told that they're not, and therefore they almost become unhealthy because of that mindset.
Absolutely. So, we would call this the labelling effect or the nocebo effect. So if you believe something will make you sick, it can make you sick. So if I take the example of autism, so really just at the very mild end of the spectrum I'm talking about. So someone with a severe illness or disease is disabled by their disease or their illness. But someone at the mild end who's only got quite minor impairments, they don't gain a lot from treatment. But if you label them, what you do is you encourage them to focus on the things they cannot do, to focus on their symptoms. You potentially encourage them to have fewer ambitions for themselves. Other people will have fewer ambitions for them. When you give someone a diagnosis, it can change their experience of their body by all of the anxious attention that's paid to their difficulties.
That's interesting because autism diagnoses jumped by 707% in the UK alone in the 10 years between 1998 and 2018. Now, were you watching that interview with Wes Streeting? I mean, did you sort of go, yeah, finally, a health secretary who gets it?
Yeah, I mean, I think that I was watching that interview, and I think that basically I am very relieved that we're having an open discussion about this. I do want to clarify something. When you're in an interview situation and somebody says, well, I think there's a lot of overdiagnosis, I think it's very open to misinterpretation by the public. I think sometimes what people think if they hear something like that is, oh, you're saying that these people have nothing wrong with them, they're a bunch of layabouts, etc. That is not the interpretation of overdiagnosis. But overdiagnosis means is that someone may well be suffering, but does it benefit them to label that suffering as medical?
OK, let's take an example. We know that so many more young people now, over the last few years, are being diagnosed with mental health problems. Are you saying that actually, in many cases, or a significant number of cases, all they're going through is adolescence, or the normal anxieties and stresses of transitioning from being a child into a grown-up, and that this is normal, and this happens in every generation and always has done, but they get the label that there's something wrong with them, they have a mental health issue, and that then pollutes their thinking about themselves.
Yeah, that's exactly what I'm saying. I'm very concerned, particularly for young people. If you tell young people that their social communication difficulties or their anxiety is not normal, and we are telling people that now, then that changes their view of themselves going forward and potentially changes their identity. There was a really interesting study recently published by the Department of Education where they compared two cohorts of school children. One set of children was given mental health awareness training in school. The other set of children weren't. At 12 months, the children who received mental health awareness training were actually worse off than the people who didn't.
No.
So what that suggests is that, if you advise people to look out for low mood, you're potentially pathologizing it. And I think that would explain we increase the number of people being diagnosed with autism in a well-meaning way with the assumption that you could create a better long-term mental health. That's not working.
Fascinating. So the group of kids who were being treated for mental health issues ended up worse off.
Not treated, but given training and understanding.
Just made aware of mental health. So we're pointing out to people that when, to be aware of low moods and to not be afraid to ask for help. But that potentially heightens those difficulties through that attention.
And I think it's really important to make that distinction because these were children not being... This wasn't about treatment.
Yeah.
Because we can't say that treating mental health makes people worse off, because so many children, in particular, and young people have to wait a long time for a diagnosis, even a consultation with someone who is an expert. And many people do need treatment. We can't, you know, you are an expert, you're in an NHS hospital, it's really important what you're saying, but I don't want people watching to think, I can't even get an appointment to see someone and I'm actually feeling worse and worse.
Yes. I think that's thank you for raising that. I think that's a super important distinction to make. So there's the value of a diagnosis is very different to someone who is symptomatic and suffering and would seek out a diagnosis irrespective of what mental health awareness campaign is about, or irrespective of screening. So people who are suffering, who are seeking out help and are obviously symptomatic, they absolutely gain from a diagnosis. But we have at the other end of the spectrum people who are being asked to examine themselves for signs of dysfunction, who would not necessarily have sought out help if they hadn't been given this type of awareness training, and resources are being directed away from those most in need.
And what do you mean when you say that there are some people who do have a condition of some kind, not necessarily anything to do with mental health, but that telling them isn't actually helpful?
So we have incredibly sophisticated diagnostic techniques now. We have genetic tests that can be done in 24 hours that will tell you, you know, a whole range of stuff about yourself. We have MRI scans that will pick up tiny irregularities. We've only been able to look inside the body for the last, you know, healthy body for the last 30 years. Now, the consequence of that is we're increasingly able to tell people that potentially they have a genetic problem that could put them at higher risk of heart disease in 30 years. Now, people think of that as empowering to know, but actually it's quite an unreliable prediction. And again, you're turning a healthy person into a patient.
Before they've become ill.
Yes, and what does that do to someone psychologically? You know, once you are told that you are ill, it changes your behaviour, it changes your experience of your body.
So would you tell somebody, for example, that they had Huntington's chorea, which is a horrible degenerative disease, and it's inescapable? If you've got it in your genetic makeup, it will come and get you. Are you saying that sometimes it's a mistake to tell people that that is their fate?
Yeah. Well, I mean, Huntington's, you know, is the first disease for which you could have a genetic test to find out that you were liable to get it. I've spoken to a large number of people who have Huntington's in the family. One woman in particular, she was 28 and pregnant with her first child when she learned her mother had Huntington's disease. Now, she could have immediately had the test to find out if she had it. But she understood something very important. If you have the test and you test positive, your whole life will be overshadowed by that positive result. And in fact, the Huntington's disease community, who can have a test to find out, only about 10 to 20% of them have the test, because they understand the value of living with a life, of having a life that has any possibilities.
Right.
And the minute you're diagnosed with a disease, you can potentially see that disease beginning before it actually begins.
Well, Dr Suzanne O'Sullivan, it is fascinating talking to you. You're a consultant in neurology, so you're right at the front line of these diagnoses. Already people getting in touch to say, how on earth can people be overdiagnosed when you can't even get an appointment? Waiting lists is a massive problem, but you've contributed to a very interesting debate. Thank you so much for talking to us all throughout the book, The Age of Diagnosis.